Welcome to week 7 of your Nursing 115 Trends in Practical Nursing class. Tonight's topic of discussion will be quality improvement. So we know that the definition of quality improvement is the systematic, and continuous actions that lead to measurable improvements in healthcare services and the health status of targeted patient groups. So this is our ability within our healthcare settings to dig deep and look into things that may have happened that were wrong, things that we want to prevent from happening, and seek alternatives to those conditions that we don't want to see. So we kind of want to sit back and take a look and say, what do we want to see happen? But what did happen? What could we do to make things better? So we're always striving in the healthcare field to make sure that we're taking care of our patients the best that we can. The processes that we use to improve measures for quality improvement, we basically follow 4 key principles. That is going to be that we focus on our systems and our processes. So our things that we already have in place, what are we doing? And what should we be doing? What systems do we follow? I'm going to focus on our patients, obviously. So if we look in terms of if we had a patient fall. So whenever we have a patient fall, we have to do a post-fall huddle. And on this piece of paper, it talks about the event surrounding the patient. So what was happening when the patient fell? What was in place to keep the patient from falling? Did he have X, Y, and Z, red bracelet, bed alarm 1? What should have been in place that wasn't? What could have prevented this? So these, that obviously focuses on our patients because we want the best quality healthcare for them. And then it also focuses on us being part of a team. We all have to work together. We're all part of it. We all play a very instrumental role in the big quality improvement picture. And then it focuses on the use of the data. So the data that we get when we do a root cause analysis, when we go in and we get information about things that went wrong, or when we do research and on how we want to implement things to make them better. So whatever information that we get from that data. So our services are designed to meet the needs and the expectations of our patients and our communities, and that is the truth. So we know that our systems that we have in place right now will meet the needs of, should meet the needs of our patients. Our care, we have to make sure that the care that we provide is going to be evidence-based. So that's why things are always changing, because we know as time goes on, evidence changes. It should always include patient safety. So that is at the top of one of the things that we want to provide for our patients. We want to provide care for them, but we also want them to be safe. That care should be very well designed with safety included. And we want to allow support for patient engagement. So designing things like bedside handoff, where we actually go in the room at shift change with 2 nurses at the patient's bedside, go over the reason why they are here, what's important for today, what are the patient's goals. It gives that patient that opportunity to engage in their healthcare and make decisions regarding their treatment. Coordination of care with other parts of the larger healthcare system. So we know it's not just nursing, it's our physicians, it's our physical therapists, our occupational therapists, our speech pathologists, our social workers, our care managers. We all work together. And then, of course, we know that cultural competence does come into play, including assessing their health literacy, patient-centered communication, and linguistically appropriate care. So we know that if our patient is deaf, or they can't see, or they don't speak the language that we speak, we need to make sure that we're putting into place things that will help them really be a part of their healthcare decisions so that they understand everything that's happening. So nurses who are part of a QI team, which is quality improvement, will work collaboratively with other colleagues and ask the following questions. So we've talked about a couple of these. What are our desired improvements? So this is what's happening now. Nurses are giving handoff every day, but they're not at the patient's bedside. That could just be one topic. So what are our desired improvements? How are changes and improvements going to be measured? So this is what we would like to do, but how are we going to see if it's effective or not? How is the staff organized to accomplish the work? How can quality improvement models be leveraged to accomplish improvements effectively and efficiently? And how is change going to be managed? So one thing that you'll notice that a lot of hospitals have in place is something called a lean management board. And this is something, I believe we may have talked about this before. It was implemented and developed by Toyota, the car company, many years ago, and it's how they operated quality improvement in their company. And because it was so successful, we started implementing into other companies, and now hospitals do it. So what they do is they take an issue. So what is our desired improvement? So say we want to improve patient engagement. So then that would be our topic, and that would be one of the goals that we were looking at, and we would put it on our bulletin board in our nursing lab, not in our nursing lab, on our nursing floor where we were working, and then we would list out how we're going to measure them, who's going to be in charge of measuring them, and they usually stay on your board for about 30 days. Every day you do audits, whatever you come up with, how you're going to measure them. And then you look at them every day and see what were the barriers to getting this accomplished. So if our ways to improve patient engagement were to have bedside nurses do bedside handoff, if we went around and did an audit during the change of shifts at 7 a.m. and 7 p.m. and we saw nurses in the hallway versus in the bed, then at that bedside, then we would have to take our clipboard and go over and say, hey, you're supposed to be at the bedside. We're doing audits. What's going on? Why were you not doing that? So then we look at those little barriers and then we see, hey, this is what's causing us issues. This is why we can't accomplish this. So what are we going to do to address those issues? And then you basically go back and you brainstorm again and you come up with new ideas, and you do this over and over again until your audits come back above 90%. If your audits are coming back and people are doing what they're supposed to do 90% of the time, then you have successfully implemented some type of quality improvement. So a lean daily management board is just one way where you can measure these changes and implement quality improvement. Another thing that you could do is called a plan to do, study, and act. So if there is something in your workplace setting that isn't working at the current time, you can design a small test of change in your daily work, which is very similar to what I talked about with the Lean Daily Management Board, but instead you would just follow this plan, do, study, act. And you would use measures to evaluate the effect of change. So some of the questions that you could look at with this would be, what are we trying to accomplish? How will we know when that change is an improvement, and what changes can we make that will result in improvement? So this is the plan, do, study, and act. It's a model for improvement. There's a lot of different ones out there. This is just one of them. It's a cycle, a plan to do study cycle that will test and implement changes in that real work setting. And then this cycle will guide the test of change to determine if the change that you're implementing is actually improving things. So your plan is you're going to develop an education process and material. So this is what we're going to do. That we've already decided what the problem is, what we want to change. This is our plan to do it. Then we're actually going to go down here and we're going to do it. We're going to deliver that education that's planned. Then we're going to go back and we're going to reevaluate. We're going to look at our evaluations from our students and our facilitators, and then we're going to act. So we're going to revise our education process or materials, whatever your topic is. That's the process that you would follow. And then most places do have a quality improvement mission. in part of their settings. It is intended to help an organization to move beyond minimal standards to higher standards of care. It is going to be accomplished through patient surveys, staff questionnaires, and patient chart reviews. So one thing that you'll see on some units, I know they do it at GBMC, is the charge nurse will go back to, they'll pick 6 patients a day during the day and 6 patients at night. And the charge nurse will go in with her clipboard and she'll ask them a series of questions. So, hi, Mrs. Jones, I'm Trish, I'm the charge nurse today. Can I ask you a couple questions about your stay? How has your stay been since you've been here? Have your nurses been doing bedside handoff with you? Are you getting to meet both nurses at your shifts? Are we talking about goals that you want to accomplish during the day? How are you sleeping at night? How's the environment? Has it been quiet enough for you to be able to sleep? Is there anything that you're unsatisfied with? So that's one good way to really gauge if we are meeting our patients' needs. Another way is that hospitals will send home questionnaires after the patient is discharged, and the patient can send them back. We do, that is how we get paid, by our patient satisfaction survey. So if we have good surveys, then we will basically get more money. So that's where the incentive should just always be to improve things so that our patients have good care. It shouldn't always be money-based, but unfortunately in some situations we do see that. And we can also use patient chart reviews too, and also the charge nurses do that. They usually rotate their audits that they do. Sometimes they do catheter audits to make sure that the patients that have catheters, that the nurses who are caring for them go in every 4 hours and document. If patients have restraints, they're going to go in and look at all that documentation, make sure it's done every 2 hours like it's supposed to. And then evidence-based shows that this evaluation process obviously is going to lead to greater patient satisfaction and safety, and eventually lower costs. And that is it, only 7 slides. If you guys have any questions, you can send me an email and I will answer any questions that you guys have. Have a good night.